What was it that brought you to that conclusion? Where along your path in medicine did you realize this isn't enough?
Well, when I was in residency, obviously I was pretty dyed in the wool. You know, we used to have a saying, you heal with steel. We would cut people open. That's, you know, and as horrible as it sounds, that's what we said. Um, when I was a second year resident, my mom was diagnosed with ovarian cancer, which was interesting because I knew a lot about that disease process being a gynecology resident. I'm also the only child, and you know, five years later, when my mom passed away, I kind of went through that. You know, she was only 56, and I kind of went through that existential crisis. You know, like where did she go, and what's going on? And I needed, you know, I needed more. And what I found was that while I knew a lot about the disease process itself, I couldn't really help my mom not live longer, but I couldn't help her live better. And so she would call me all the time after chemo and whatnot. And, you know, her joints were hurting and she had the hair loss and she felt miserable and they wouldn't give her hormones because of the cancer. But I couldn't give her any recommendations about just living a productive, healthy life. And she really suffered. And so when she passed away, as we all do when we're having a spiritual crisis, we go to Sedona, and that's where I went. And I was reading a book when I was there 20 years ago called 8 Weeks to Optimum Health by Andrew Weil. And in that book, he talked about these really crazy ideas at that time, fish oil, CoQ10, things now that we just take for granted. But back then it was pretty impressive. And at the back of the book, it said, "Are you a physician and are you struggling?" And I was like, yeah, you're talking to me. And he had this fellowship in Tucson at the time where you could go learn about integrative medicine. And I actually lived in Tucson. So it was just serendipitous that I was there. And so I signed up for that. And then during that 2-year fellowship, there was an 8-week program in spirituality and health and how you can heal the body without, you know, with just your thoughts and with, you know, spiritual practices. And that just literally blew my mind. So I went ahead and did a 6-year PhD in philosophy. That was more for my own, that was part of my journey. But it kind of wove its way into the book and into the way I practice.
Yeah, and it's really interesting because I feel like a lot of physicians try and separate spirituality from medicine. And that's kind of, I guess, what you're taught in a sense. There is no spirituality really in the medical field, or at least in treatment of patients. But you saw that firsthand that it was essential. You trained with people that showed this is not something that's separate from the patient. It's not that, hey, they have a medical condition, their spirituality is completely not a part of this, and they could go to their priest or whoever to deal with that. But what were some of your, coveted spiritual practices that you applied, that you're seeing and you're still applying, that you're seeing are actually beneficial on the medical side?
Well, I have to give the proviso that I am probably the world's worst patient myself. So while I know a lot of things and I know what I should be doing for myself, man, I wish I would listen to myself half the time. But really, I think a lot of what we experience, and this is probably a no-brainer for most of your listeners, stress related, lifestyle related, diet related. And I was treating things as a Western physician, more problem based, like disease based, and not preventive based, not root cause based. And I think there's definitely a place for both of those. We need surgery still. People need their gallbladders, their appendix removed. But why do we even get to that point in the first place where you have to have your gallbladder removed? And I think most of us would probably agree it's probably diet. And we don't learn a whole lot about that. And still, even now, the thing about integrative medicine that's great is that I have assembled a team around Austin and the United States that I will refer people to if I feel like it's out of my depth. And my depth is women's health and hormones. But I don't, gut is, while I think it's super important, I have friends that are more into gut health than I am. And so I'll refer to them, or naturopaths and essential oils and things like that. So the beauty of my journey for me, and I think that's translated into my patients, is that I have made some really great friendships. I've made some really great alliances in the alternative healthcare community. And it's really firsthand for me, I could see where this could really work as a way to heal people and to keep them healthy if we could just get past our petty squabbles in the different fields and just get along.